Hello, this is Dr. Mukhtar Rima. Welcome back to my channel. Today, let's talk about a very interesting and important mental health condition that affects children, adolescents, and sometimes even adults. That condition is called Attention Deficit Hyperactivity Disorder. Have you ever heard of a child that teachers consider to be very stubborn because he does not follow through instructions, or because he does not stay in his seat when every child is seated? That child is labeled as being stubborn, and he often faces disciplinary problems simply because of those behaviors. This is, however, probably because he has this illness that is called Attention Deficit Hyperactivity Disorder, and we are going to look at the symptoms of this disorder in this video so that parents and teachers would know that this child is not being deliberately mischievous, but that he has a medical or a psychological condition that needs to be diagnosed and treated if he has it. So let's go right into it. Attention Deficit Hyperactivity Disorder, also called ADHD, is a condition that presents predominantly with two categories of symptoms. As the name suggests, it is a disorder in which the attention of the child is not sustained, or in essence there is a problem with attention, and then there is also a problem of hyperactivity. So let's look at each of these categories. The first category of symptoms are the symptoms of inattention, since we say it is a disorder that affects attention, and it is also a disorder that affects activity where the child is very hyperactive. So what are the features that would suggest inattention in a child? One of them is that a child with ADHD would appear to have difficulty sustaining attention in order to complete a task or to complete a certain responsibility assigned to him. Issues with sustaining attention is that he will start a particular work. Maybe he's a child who was given an assignment by the teacher from school, and then he sits down, he starts the assignment, and 2 minutes maybe into the assignment, he gets distracted and he immediately goes to start doing something else. The second pointer to inattention in a child that has ADHD is easy distractibility. A third pointer to inattention in a child with ADHD would be his failure to pay attention to details. When a child is given assignment and the child is executing or is going about doing the assignment, you expect that there are some certain mistakes that he shouldn't do, especially if it concerns things that you know that he already has gotten knowledge of. So for instance, you do not expect him to be misspelling some certain words or to be removing some certain things, but since he has difficulty paying attention to details, you see him making silly mistakes that he should not make at that age and at that level of his education, and for his level generally, he should not make those mistakes. Another pointer to inattention in children with ADHD is that they have difficulty following through instructions. So if they are given some specific instructions to do things a certain way, they will probably begin to execute those responsibilities, or they will start the task only for them to halfway into it stop executing the responsibility completely, and they do not follow through with those instructions. Another pointer to inattention is that when the child is being talked to, he does not appear to be listening. So maybe a teacher is talking to him directly, and the teacher expects that he should pay attention to what she is telling him, or at least he should appear to be listening to what she is telling him. This child would appear to not be listening while he is being spoken to directly. Another pointer to inattention is that the child would be forgetful, either that he will be forgetful of maybe where he keeps things, or he'll be forgetful that the parent asked him to go and bring something. So there's general forgetfulness, and like we have said in some of our previous videos, forgetting is a function of getting in the information in the first place. If the child was not paying attention while the message was being given to him, of course he will have difficulty remembering. So, and that is why attention affects memory a lot. Another pointer to inattention is that the child would be losing things. The child would be losing things that are needed for schoolwork, for instance, or if it's an adolescent or an adult, he will be losing things that he needs at work. So he goes to work, he needs some certain instruments, he would find that he doesn't have them. Or if it's a child, he goes to school, he needs his pen or pen pencil or book, he will realize that he has lost them. So losing things is a pointer to inattention. If the child had the capacity to pay a lot of attention, then he would not perhaps have been losing things that he needs for schoolwork and for other activities. Another pointer to inattention is that the individual will have difficulty organizing. The individual will have difficulty organizing tasks or activities. Usually, you need to pay a lot of attention when you are organizing a task or an activity. You need to pay attention to think that this thing is needed here, this thing is needed before here, this thing has to be done before this. Kind of think through the whole thing and organize things in a sequential order. Because attention is a problem, he does not have that capacity to organize things, arrange them in a sequential manner to execute a task or an activity. Another very important pointer to inattention in a child with ADHD is reluctance or difficulty in undertaking any activities that require sustained mental effort. Any activity that requires him to task his brain would be denied or would be refused generally, or he will only engage in it with a lot of hesitation. This is because the child has to force themselves to pay a lot of attention in order to execute those tasks. So for instance, even assignments require the child to pay a lot of attention to sustain their attention in order for them to execute and finish the task. So you see that children with ADHD do not usually like doing their assignments. So these are the pointers that this child has inattention, and maybe the inattention might be as a result of ADHD. So the next category of symptoms in ADHD are the symptoms of hyperactivity-impulsivity. Hyperactivity and impulsivity symptoms are lumped together, and we are going to go through them also. One of the features of hyperactivity in a child with ADHD is that the child would always be on the go, as if the child is being driven by a motor, always going, always doing something, always moving, always doing something. Another pointer is that the child will always be running, jumping, or even climbing excessively. The climbing might even occur at places where it is inappropriate to climb. For instance, in classroom, when every other child is sitting down on their seat, this child might be seen to be jumping and climbing on their desks. Another pointer is that if this child is seated where everybody else is expected to remain seated, the child might have difficulty remaining seated, and they will be found to be often leaving their seats. And this is in a situation where sitting is expected. Or if they are somehow forced to sit down, you see them fidgeting around, fidgeting with their hands, squirming around, trying to kind of move, kind of restlessly trying to show that there is hyperactivity going on with them. Another feature of hyperactivity is that the child tends to have difficulty playing quietly. Normally, children that are not... Another feature of hyperactivity is that the child tend to have difficulty playing quietly. So if the child is playing and they have ADHD, you will really hear them in the background talking, jumping, playing excessively, and kind of playing that suggests that they are not quiet. Again, children with hyperactivity in ADHD tend to talk a lot. They tend to talk excessively, talk about a lot of things. The impulsivity of children with ADHD is because they have difficulty giving thoughts or thinking through any course of action. They do not care about the consequences or the risk associated with actions or with behaviors, and that's why they also tend to have some impulsive symptoms. One of these impulsive symptoms, or how you know that this child is probably impulsive, is if you ask them questions, before you finish asking the questions, they have already come up with an answer, and that often leaves teachers baffled. Or at times the teacher is talking, and before you finish your sentences, the child helps you complete the sentences, and this again might make some teachers to be baffled a little. Sometimes during conversations also, they hardly wait for you to finish whatever it is you are saying before it comes for their turn to talk. They do not have that capacity to wait, and therefore they just keep talking, and they therefore do not wait for their turn during conversations. Also, children with ADHD tend to have difficulty generally waiting for their turns during other activities, whether during games or during conversations or during anything. Hardly do you find them having the capacity to wait for their turn. So if it is during a game, you see that somebody has given them the opportunity to take their turn. When it comes to another child's turn, this child would would still not want that child to take his turn. Or before it even comes for their turn, they will go and engage. So that difficulty in waiting for their turn is again another feature suggestive of impulsivity in children with ADHD. Another feature suggestive of impulsivity in children with ADHD is that they tend to interrupt or intrude on activities or conversations. You are discussing, you are conversing on something, and as soon as this child or this guy comes in, he will just go right and bump into you guys, and he will go into this middle of your conversation. Or if it is a game that has already been going on, the child will just come, interrupt, and intrude on people without trying to wait to know what the rules of the games are, how far they've gone. No. This child will go right into it and he will intrude on them. And so this usually leaves other children that he plays with frustrated. So these are the symptoms of ADHD, the inattention symptoms we've seen, and these hyperactive impulsive symptoms. For the symptoms to be considered significant, they have to be considered to be outside the limits of what is expected for the age and for the intellectual development of the child. Usually children who are very young are not expected to understand any structure in the way things run. So it's not abnormal for a child who is less than that age, maybe less than 3 years old, to come in and bump into things, interrupt things, and then to not generally understand structure in games. So he might want to kind of interrupt and intrude, kind of. But once a child is 4 years and above, there is some level of understanding that is expected of the child, so that for ADHD symptoms to be considered significant, the age of that child has to be taken into cognizance. For instance, a 5-year-old is expected to understand structure, and if he exhibits features of ADHD at that age, it can be diagnosable. Another thing that is taken into cognizance is that for the ADHD symptoms to be significant, they have to have lasted a number of months, usually 6 months. This suggests that these symptoms are persistent and that they probably require medical attention. ADHD symptoms also have to be present in more than one setting. There are settings, for instance, at home when the child feels comfortable, so he might engage in a lot of naughty things. But if those kind of behaviors are extended maybe at school, or maybe when he goes visiting to a place where he is supposed to have some certain level of restraint and he nonetheless exhibits all those features, then you know now these symptoms are important because it is present in more than one setting, usually at home and another setting, school or some other foreign places. Additionally, the symptoms have to result in functional impairment. Functional impairment, especially in academics. Children who have ADHD tend to have a lot of issues with school. We mentioned that he is going to be very hyperactive. He is also going to be very inattentive. So if he is being taught something, the chances are that the child is not listening to whatever the teacher is saying. Therefore, he is not likely to have a significant level of academic achievement. Occupationally too, adolescents and adults with ADHD also tend to have difficulties with work. Remember, we said that they tend to lose a lot of the things that they need for work, and then we mentioned that they do not want to be given tasks that would require some form of mental activity and all that. So because of that, they are likely going to have occupational problems. Socially, they also tend to have a lot of problems, because if this child, whenever he goes to play with you, he doesn't wait for his turn, he would always intrude on you. The tendency is for you not to want to play with that child. So they tend to have those kind of social impairments. And as a consequence of that, they end up having low self-esteem because no child wants to play with them. So they feel isolated. They are always active. They think as if something is wrong with them. Why would these children not want to play with me? They will always isolate me. They will always not want to play with me, kind of generally. So this results in low self-esteem in children with ADHD. Also, children with ADHD tend to have disciplinary problems because their teachers tend to think that this child, as far as they are concerned, is just trying to be naughty and troublesome. Therefore, they will always be punishing him. They will always be excluding him from some certain tasks and what have you. So being involved in a lot of disciplinary issues also contributes in them having that low self-esteem. They will realize that all other children are not being punished. I am the only one who is always being punished. Plus, the children themselves do not like to play with me. So that results in low self-esteem in children with ADHD. So having said this, what is the solution to this condition? ADHD is a medical condition that has effective treatments. There are effective treatments in form of medications, and there are what we call psychosocial interventions. The psychosocial interventions are usually targeted mainly at the parents, but also targeted at the teachers. Thank you.